Paul, you have the floor.
Thank you very much, and good day to the DG. My question is on making the quality and reach of health initiatives on the continent to be focused on more local approaches. What am I trying to say? We've seen this increase in restrictions around donor funding, and there is this perception among experts that a lot of this donor funding are no longer coming back. And we continue to see, especially in today's conversation, one of the goals has always been Africa needs more vaccines, but we are still looking at measures that are not vaccine related. Are you concerned that the increased conversations around vaccines will still be limiting the attention to preventive measures that may be more cost efficient? And if you look at a broader strategy of lowering the cost of doing public health on the continent, prevention is always still much cheaper than trying to control. If you remember, during the financial impact of the COVID, one of the concerns was that if we had spent 1/10 of what we spent as prevention, could have made a lot of progress. So how is the Africa CDC aggressively prioritizing prevention, which is in its name even more than control?
Thank you so much, Paul. Everything is about a vision. We have a clear vision. I think you saw us appointing a substantive director for primary health care. We didn't have this position before. And even the person we appointed is a person who decided to leave UN organization to sit and to be a Africa centrist staff. Around the primary health care, we are bringing this component of prevention. We talk about vaccination, we talk about nutrition, we talk about wash, we talk all of these components. And this component are around the community health workers. There is no one who can help a community to prevent outbreaks like a community health worker can do. But we need to train them, we need to equip them, we need to put in place a system of alert. Paul, this is our major priority today. Because you are right when you say we need more prevention than the curative approach. But when we talk about prevention, we need also to manufacture our own product. This agenda is really moving. We know, and I have to say it, not so many partners, not all partners are helping Africa for this agenda. You can quote me. We want all of them to support our vision. Don't come to say you are supporting us if you are not following our vision in Africa. And this agenda is not an agenda of Africa CDC. It's an agenda of all African leaders. This is why we will celebrate in the next 3-4 years the first 8 vaccines coming from Africa. We managed to put in place a pool procurement mechanism. In the coming weeks, you'll get the good news of this African pool procurement mechanism, signing agreement with some key partners, because we didn't sign, I don't name them, but I know who are coming to sign with us. We also managed to put together, following the Pan-African Health Organization model, our national regulatory authorities, because that one is used as an excuse to say that Africa doesn't have capacity on the regulatory aspect. While we are supporting the African Medicine Agency, believe me, we are really moving with this agenda and will make progress. Paul, I will come back to you regularly for some update on this area.